the same for the penis as well. So a person who has not used the penis for a very long time likely to suffer atrophy of the penis. But the more you use and exercise the muscles, the more it stays as it is, and the more healthier it is. And as a matter of fact, research has shown that men and women who have sex at least 2 to 3 times a week look 5 to 7 years younger than their counterparts who do not have sex as often as they should. Yeah.
All right. Now, there's a question that somebody has sent to me. It's asking that, what are some of the techniques you teach someone who has premature ejaculation?
Yes. So, like I said, if someone is having premature ejaculation, usually we would want to take a history, a comprehensive sexual history, to determine where the problem is. Is it which stage of the sexual cycle is there a problem? You notice in men, once men are in the excitement phase, if the excitement continues, there is sometimes a release of the seminal fluids from the Cowper's glands and the seminal glands, where you will see as the precum. And any small hole or tightening of the penis around that particular period of time can even cause the person to ejaculate even before he enters into Israel. You understand what I'm trying to say?
Oh,
so yes, so that is what sometimes can happen in people. And so it is important to understand where in it does it happen. You get it? Yeah. And then, but if it is purely as a result of just in orgasm, what we would advise the person is that, I would always say this, that the most important muscle in a man is not the pectoralis. The most important muscle in a man is not the biceps, neither is it the triceps. Okay. The most important muscle is the pubococcygeus muscle. That is the hammock that holds the root of the penis. And it is that contraction that causes the spurt of the ejaculate. And so if you have a strong pubococcygeus muscle, you can sense ejaculation before it comes. Once you are able to sense ejaculation before it comes, you can decrease the stimulation. Take note, ejaculation occurs as a result of extra stimulation. So the stimulation continues to go up until it reaches a peak, and then the person releases. So once you are able to sense that you are about to reach that peak, you can hold it with your pubococcygeus muscle. A practical way to know this is a man's ability to be able to hold urine and squeeze the penis from and prevent the urine from coming. That muscle that you use to hold your urine is that particular muscle that would help determine whether you can delay ejaculation or not. And so techniques that we usually teach is what we call the Kegel exercise. And this is the goal of the Kegel exercise, to strengthen this particular muscle. So anytime you are going to urinate, you can try to see if you are delaying the urine and hold 3 seconds and release 3 seconds, hold 3 seconds and release 3 seconds. Do that for 5, then gradually increase to 5 seconds, gradually increase to 10 seconds, in that order, exercising your pubococcygeus muscle to ensure that it is strong enough. Then again, we have the squeeze technique, where in the squeeze technique, you would, once you notice that you are about to come, you hold and squeeze the glans penis. Holding and squeezing the glans penis decreases, this is the physiology behind it, it decreases the extra stimulation that you are getting. and then can push the sperms back into the epididymis in order for it to be released. These small techniques can delay ejaculation. And once your penis is inside the vagina, ejaculation is more or less bound to come. So if you remove it and immediately start to think about Manchester United losing against Brighton, it causes a decrease in stimulation. Right. It causes you to feel less pleasurable. This less pleasurable sometimes can cause the penis to become slightly flaccid. Once it is becoming slightly flaccid, then you go in again and continue. Another technique is what? To change your position. In the process of changing your position, you are not inside. And so this process delays stimulation and decreases stimulation. All these techniques are very important in delaying ejaculation. And as a matter of fact, you can go 1 hour, 2 hours without needing Viagra or needing a lawyer.